All right, hi guys, my name is Allison Lazo-Pacheco. I will be going over stroke on chapter 28, which is on pages 325 to 332. So what is a stroke? A stroke occurs when the brain is deprived of blood for a period of time and causes part of that part of the brain to die due to lack of oxygen and nutrients. Strokes are the leading cause of disability and death worldwide. They do cause permanent brain damage. However, some people do recover from them. Recovery is mainly based on the severity of the stroke as well as how quickly you can treat the stroke. So it's important for us as clinicians to be able to identify these symptoms. Most people that die from a stroke are over the age of 65, and women are more likely to die from a stroke than men. The risk of stroke doubles every 10 years after the age of 55. So there are two main types of strokes. There are ischemic strokes and hemorrhagic strokes. Ischemic ones are when something prevents the blood from reaching the brain, whereas hemorrhagic strokes occur when there is a rupture of one of the blood vessels. So ischemic strokes make up 85% of all of the strokes, and the most common cause of an ischemic stroke is due to a blockage of an artery. They can be blocked through either plaque due to atherosclerosis or a thrombus of some sort. Carotid arteries are the most common site for plaque formation, and a thrombus can form on plaques or in a diseased heart, such as one with coronary artery disease. In hemorrhagic strokes, they occur when the blood vessels in the brain are weak, abnormal, or under unusual pressure. There are two main types of hemorrhagic strokes, the first one being intracerebral, which is bleeding within the brain, and subarachnoid, which is bleeding within two layers covering the brain. The intracerebral hemorrhagic stroke is the more common of the two in people over the age of 60. What happens here is that blood accumulates around the brain tissue, which causes pressure, swelling, and therefore damage to that brain tissue. So there are multiple risk factors. I have split them up into medical history, social history, as well as additional risk factors. So for medical history, there is hyperlipidemia, which is high cholesterol levels, atherosclerosis, which is hardening of the blood vessels, history of heart conditions such as arrhythmias, valve disorders, heart attacks, and aneurysms, hypertension, diabetes, and recent history of transient ischemic attack. TIAs are very similar to strokes in presentation. However, the symptoms only last 90 minutes or less. If a person has had a TIA in the last month, they are more at risk to having a stroke. However, if it has been in the past 2 days, it increases their chances of having a stroke. For social history, we have smoking cigarettes, lack of physical activity, being overweight, and increased alcohol consumptions. We've all already kind of gone over this. Some additional risk factors here. The connection to stroke is somewhat unclear, but people have seen that inflammation such as periodontal disease or rheumatoid arthritis can cause an increase in risk of stroke. If a person has tendency to clot easily, again, we talked about the formation of a thrombus, which is a clot dislodging off a vessel and traveling through the vessels of the body into the brain and blocking blood flow there. So if they're more prone to clots, this is an additional risk factor to stroke, as well as increased levels of homocysteine in the blood. Something that is important to point out is that as we age, we naturally have an increased level of homocysteine in the blood. So it is something to look out for. There are early and late symptoms as well that can occur with strokes. So we are familiar with some of the early symptoms, but just to cover them again in lay terms too, is difficulty moving. You'll see some paralysis or feeling of one side of their body. So they may just have weakness, or they may have full paralysis, as well as the sensation might be a little altered. So they might have numbness, tingling on one side of their body. So you'll also see dysphagia and aphasia, so they will have difficulty speaking or understanding speech as well. These patients, stroke patients, will have vision changes, so if they say anything about vision loss, double vision, blurry vision. These are all things to look out for when concerned about a stroke. These patients may also notice a loss of balance and coordination. Some may experience vertigo or dizziness. And severe headache with no cause. So this is more specific to subarachnoid hemorrhage. This is because they have that thunderclap, all of a sudden headache. So these are important things to look out for when catching a stroke early on. As we mentioned before, it is important to catch these early on so that you have the highest likelihood of a speedy recovery. So some symptoms that may occur later on, these symptoms do tend to progress if it is a true stroke. Again, like I mentioned before, a TIA will subside after 90 minutes. However, a stroke will continue to worsen as things progress. So they will have dysphagia, difficulty swallowing, difficulty ambulating, so just walking around in general because of the weakness on that one side of the body, depending on how it progresses. So if they originally had it up in their upper extremity, it may progress down to a lower extremity. Some patients experience partial hearing loss, urinary and fecal incontinence, as well as difficulty with memory. So these memory changes could be something as orientation, so they might not know where they are, what time it is, what brought them to the emergency room. We would hope that they're in the emergency room, as well as short-term, long-term memory or learning new things as well. And a later symptom that might occur is nausea, vomiting, and drowsiness, and this is specific to hemorrhagic strokes as well. Some complications that occur after a stroke is going to be injury to that weakened side of the body. So if someone had a right weakened side, again, you know that they are unable to move it as well, or they have weakened sensation. So they are more prone to injury on that side, unfortunately. Aspiration pneumonia can occur when these patients have difficulty swallowing their food, and they might accidentally inhale their food or water, thus causing aspiration pneumonia. DVTs and pulmonary embolisms are also very common complications after a stroke. Just because they are bedridden, they might develop a thrombus or a clot somewhere in their body, such as in the leg for a DVT. It'll dislodge and then travel through the body and end up in the lungs, creating a pulmonary embolism. UTIs are common due to the urinary incontinence, and stiff joints, muscles, and bed sores are also very common complications due to the lack of movement after a stroke, depending on the severity. Some patients may be bedridden for some time, thus creating these issues. And this is my reference on the Merck manual. Hope you guys learned some things about stroke.